Now, in the second wave of COVID that hit Delhi, 5 cases of cytomegalovirus or CVM-related rectal bleeding were reported in 5 patients with coronavirus in the Sir Gangaram Hospital. Now, patients with cytomegalovirus have complained of bleeding in stools and of abdominal pain. One patient even died while others are being treated. Well, to talk more about this infection that has emerged in the second wave, we're joined by Dr. Anil Arora, Chairman, Institute of Liver, Gastroenterology, Sir Gangaram Hospital. Thank you so much, Dr. Arora, for joining us. If you could tell us about these cases that are emerging, and this has emerged for the first time in the second wave.
Yeah, you see, cytomegalovirus infection is a common commensal in the body. If we test it in the blood, 80 to 90% will have it as a dormant infection. It lives in a complete harmony in a patient's body. So whenever for different reasons, either because of the virus itself or because of the therapy which is given to take care of the virus, if there is a plummeting of the immune system and immune system is suppressed, then virus tends to show its ugly head, tends to get reactivated and affects the various parts of the body. In our patients, this unfortunately had affected the intestines, leading to ulceration in the large and small intestine, presenting with gastrointestinal bleeding. Of the 5 patients we have had, one had a massive bleeding. He also had a concomitant chest infection and died. One patient required around 18 units of blood transfusion requiring surgery. And in 3 other patients, luckily with antiviral therapy specifically meant for CMV infection, we were able to control the infection with antiviral drugs.
Right, doctor. So you've had these 5 cases. Unfortunately, one has died. Have you heard of such cases in other parts of the country in this second wave?
We did scan the literature, we looked at the media and the publications, and we couldn't find a similar report post-COVID of patient presenting primarily with GI bleeding as a first manifestation after recovery from COVID. See, what we believe is that during COVID, you will have immune suppression and so many viruses. If you remember, we also reported black fungus and white fungus from Gangaram Hospital itself. That was during the time of COVID infection, primarily the second wave. But what was surprising and peculiar and unique in our patients was that these patients had apparently recovered from COVID, resulting in suppression of their immunity. That is the time virus found a good opportunity to get back to its senses and produce alteration in the GI tract. Virus can also affect other parts of the body, including lung, brain, but our patients typically had only GI symptoms. That is the reason they came to us as in gastroenterology. We are not aware of any similar publication from India anywhere.
Right, doctor. In fact, in the second wave, and correct me if I'm wrong, but there have been more cases of gastro-related, impact of the COVID infection than we saw in the first wave, at least.
Yeah, you see, this virus is known to have entry into the body cells through the ACE receptors. Now, ACE receptors are known to be primarily present in the lungs, but they are also known to be existent in the GI tract and also in the hepatobiliary system, which is a part and parcel of the intestinal tract. So whenever you have either the drugs which are given to take care of the viral infection, most of these drugs, including antibiotics, steroids, or immunosuppressants, will have some collateral damage to the intestines, and there is also direct effect of the virus onto the intestine. In fact, in the first published literature from the Western world, 1/3 of the patients with COVID-19 had first presentation with intestinal symptoms in the form of abdominal pain, nausea, vomiting, and bloating. But this type of massive bleeding requiring hospitalization was peculiar to us and possibly resulted because of the suppression of the immune response following a severe COVID infection. Moreover, the drugs which are given to treat this infection, like tocilizumab, tofacitinib, or steroids, further cause suppression of the immune system. So you have a double whammy of the virus itself and the treatment given to take care of it.
And if you could tell us, those who have recovered from COVID, what do they need to watch out for so they can, catch it early? Though it does seem just 5 cases so far, so it's possibly not something that is very prevalent.
Yes. We wanted to increase the awareness of this peculiar entity. As I said, the virus is not unknown to us. It is a common part of our body. 80 to 90% of us harbor the virus in a very dormant, latent state. But our our impression was that if we are able to increase the awareness of this atypical manifestation, so anybody who has substantial bleeding following recovering from the COVID, especially if it is not settling with the common drug, one has to think of this unusual infection also.
All right, Dr. Anil Arora, thank you so much for joining us here on the program.